According to experts at a recent event, colorectal cancer accounts for the fourth leading cause of cancer deaths in Nigeria based on data from the World Health Organization. The disease claimed around 5,912 lives in the country. Colorectal cancer is also the fourth most prevalent cancer in Nigeria after breast, prostate, and cervical cancers, with 8,114 cases recorded in the WHO's 2022 Global Cancer Observatory. During the awareness event, radiation oncologists urged the prioritizing of early detection efforts, stating colorectal cancer has a higher chance of being cured when caught before symptoms appear. Health experts advised maintaining lifestyles that can reduce colorectal cancer risk, getting screened regularly, achieving a healthy weight, avoiding smoking, exercising regularly, limiting alcohol and processed meat intake, and increasing fiber, calcium, and vitamin D consumption. To discuss this, I'm joined by consultant gastrointestinal surgeon at Lagos State University Teaching Hospital, Dr. Oshodi Olabode. Doctor, good to have you on the news. Can you elaborate for us what this colorectal cancer is and how it affects Nigeria, particularly as a public health burden?
Okay, thank you, and you see, the intestine of we human beings composed of two types: the small intestine and the large intestine. The large intestine is the one we call colon, and the most downward part of it is called the rectum. So tumors or cancers of these two parts of the large intestine is called colorectal cancer. And like it has been said, is the fourth commonest cancer in the world, and Nigeria inclusive. So it's essentially a growth, that is that is beyond the normal growth of other cells in the intestine that we call cancer of colon. Any growth that is beyond the normal cells. And this cancer is particularly common. The male ratio is about the same, just slightly commoner among the males, but both gender are at risk of colon cancer. And the thing about it is sometimes it can be described as a quite forgiving cancer, because if it is detected very early and appropriate treatment is instituted, there's a significant chance of cure and disease-free survival if we take urgent
Action.
treatment.
What are the typical signs of this cancer, and when should individuals seek medical attention if they experience symptoms?
Usually, this cancer is quite uncommon below 40 years. Most people above 40 years, if they start noticing some symptoms like passage of dark stool that is offensively swelling, that's one of the commonest early symptoms. Sometimes, also other symptoms that the passage of red blood in our stool. You see the blood mixed with the stool. I'm not saying all the disease every time we see dark stool or blood in stool is a colorectal cancer, but these are some of the early symptoms. Other symptoms is you can have, you start noticing constipation. You just find that it's a change in your bowel habits. Instead of going to toilet every day, now start going to toilet 3 times after every 3 days. Once you start having change in your bowel pattern like that, is one of the signs of one of the symptoms of bowel cancer. It could also, in worst case scenario, it could present with difficulty with passing stool and passing gas. Other symptoms could also be that you could have some unrewarding efforts at defecation. What I mean by that is that you go to the toilet to try to pass stool and it's not coming. You have to stand up, go back to your seat again, or go back to your bed again. Only after a couple of minutes to few hours later, you feel the urge together, and then you go, and then it doesn't, you don't quite feel comfortable emptying your bowel. These are some of the signs of
All right, I'm told we have
colorectal cancer.
I'm told we have less than a minute for the this conversation. So quickly, talk to us about the preventive measures individuals can adopt to stop them from getting this cancer.
Well, some of the preventive method is apart from living a healthy lifestyle, regular exercise, eating a lot of vegetables, making sure that you take a lot of fruits, then screening, routine screening is quite important, and seeing doctors regularly once you're more than 40 years, doing routine colonoscopy and stool testing helps in catching the disease early and preventing disease progression. So these are some of the things you can do
Dr.
to mitigate
Olabode, thank you
against
very
this
much for
disease.
speaking with us. We appreciate your time.